Hi, this is Verma. I'm one of the cardiologists here in town, Vaisali. I've been practicing here for, well, almost 20 years now. Today I'm just going to give you a little insight about coronary artery disease. These are the arteries, which supply the heart muscles. And these are the ones which, if they close down, causes a heart attack. So here there's a little picture of the heart. There are three arteries which run on top of the heart and give branches inside. This is the one which goes in front of the heart, we call it the LAD. There's one which wraps around the heart, we call it the left circumflex artery. And then there's an artery on the right side of the heart, we call it the right coronary artery. Another picture of the heart again, showing the artery which goes in front of the heart in kind of detail. And these are the arteries which give branches and supplies the heart muscle. And just kind of doing a little cross section. So this is how the blood flows through the arteries to the rest of the myocardium. Myocardium is the heart muscle. And you can see the right blood cells kind of flowing. This is a normal coronary artery which is wide open. And then once the plaquing starts, you can see how it goes. See, now this is a plaque formation within the arteries. So that's the yellow stuff is the cholesterol plaque. And here the blockage is minimal, not too bad, so it's not obstructing the blood flow to the heart. And then as the blockage keeps getting worse, the diameter gets smaller and that obstructs the blood flow to the heart. And at this point, probably, now here you can see it's tighter and there's hardly not too much blood going through it. And that's when you can start having chest pains or arm pain or jaw pain. And once the artery closes down like this, then there's no blood going through. That's when we have a heart attack. Catch things here. Once you have some symptoms, go in there and do the angioplasty, put a stent. Now when we do the angioplasty, we put the wire through this blocked area with the balloon, and the balloon expands and that pushes the plaque on the side just like this. And then we also put a stent. So the stent is like a mesh of stainless steel wire which stays in there, and that prevents the plaque from going back and it keeps the artery open. Of course, when we're all done, the wire and the balloon comes out, but it pushes the plaque and then you can see the blood flow to the heart is again normal. So that's how we treat patients with angina or patients with heart attack, and that's what's called angioplasty or stenting. And I do all those procedures. I do that for the heart. I even do it for the legs. Legs also, it's a similar situation. There's narrowing. Your leg starts to hurt. We put the wire, we do the ballooning. Sometimes we put a stent that improves the blood flow to the leg muscle and takes care of the pain. So if you have any other symptoms, just feel to call me and then we can take over. Thanks for listening.